One important consideration when approaching any patient with an indolent B-cell malignancy, most commonly follicular lymphoma, is to ask the question of whether the patient needs to be treated. In this case, I think it was pretty clear cut. The patient was symptomatic, the patient had cytopenias, and there was really a clear cut indication for treatment. But this approach really applies at every relapse. This is a chronic disease. None of the therapies that we're discussing today primarily are curative. So we're really trying to relieve symptoms from the disease. And at every time point when there's disease progression, one has to ask the question, is there an indication for treatment? And I think in this patient, there clearly was. There are a couple of other important points illustrated in this case. One question is, after initial remission induction, in this case, R-CHOP, are there prognostic factors that we can look at that point? So this patient did not achieve a complete remission. It's after their R-CHOP induction, and this bodes quite poorly for patients. So we have to be really on our guard that this patient is going to have a short remission, even with or without maintenance therapy. A second major question is the benefit of maintenance. To date, really, there's been no trial in follicular lymphoma that showed an overall survival benefit to rituximab maintenance or any anti-CD20 antibody maintenance for that matter as part of initial therapy. And for this reason, I think one can go either way on maintenance. And it comes down to a long discussion with patients about the pros versus cons of maintenance. The pro might be that you would extend the remission duration. However, this may come with chronic B-cell depletion and some low-grade infections and hypogammaglobulinemia. So I think for the vast majority of my patients, I actually don't give maintenance based on the fact that there is no overall survival advantage. And there's some data to say that you actually get the same amount of mileage with less doses of rituximab by not giving maintenance therapy.